Well, first of all, we look for various mechanisms of vision loss. And of course, the most commonly seen one is papilledema. And why do people develop papilledema with raised intracranial pressure? Let me give you just a very brief explanation. So first of all, the eye is a direct extension of the brain. And the eye is connected to the brain via the optic nerve, which basically serves like a cable connecting the eye to the brain. And within the optic nerve, there are 1.2 million axons, nerve axons in the optic nerve. So think of it like wires going, bound together as a cable. And then there's a sheath around that cable. So there's a covering around that cable, which is called the optic nerve sheath. Now, normally there is fluid inside that sheath. It's cerebrospinal fluid, the same fluid that surrounds our brain, and our spinal cord is found within that sheath around the optic nerve. But when the pressure goes up, that fluid pressure rises, it puts pressure on the optic nerve, puts pressure on those axons, and basically the axons swell and they get distended. There's axoplasmic flow stasis. And that's why patients develop papilledema with raised intracranial pressure, because there's increased pressure within the optic nerve sheath that's compressing the nerve and causing this. So this the diagram on the right-hand side is a cross-section. It's a schematic, a cross-section of the optic nerve head. So on the top one, A, you can see that the fibers, I'm sorry, my pointer is not working, but the fibers are very loosely organized. But in B, which represents raised intracranial pressure, there's increased pressure within the sheath, and then the fibers, the axons get straightened out. They're very tight, and then that swelling gets transmitted to the optic nerve head, and it presents as papilledema.